All right, looking at drugs for treating mental health conditions. So in this, we're going to be talking about some of the mental health conditions that we discussed in from the pathology chapter. We'll be expanding a little bit on those and just, again, spending most of the time talking about, very common drugs that will get utilized in as far as treating mental health conditions. So looking at mental health conditions in general, so we have here, if we look at the DSM-5, so the American Psychiatric Association Diagnostic and Statistical Manual of Mental Disorders, which kind of then that particular thing gets into classifying different types of mental disorders. But here we look at a mental disorder. So anything that's really going to cause a significant impact on a person's cognition, their emotional regulation, their behaviors, and it's dysfunctional in as far as like psychological, biological, or any developmental issues related to mental functioning is really what a mental disorder is. And there's common mental health conditions listed on table 18.1 is a nice little summary. Some of which we've already kind of talked about. There's some that we didn't get into in the pathology chapter, but we'll talk about them through this. So this chapter will kind of discuss some others as well. So just to show the relevance here, nearly 1 in 5 adults is diagnosed with a mental disorder. So there's plenty of things that we look at as far as like, you basically look at like in what way is it affecting behavior, in what way is it affecting emotional regulation. So when we're classifying this, we look at AMI, or basically any mental illness. Again, in there we're looking at any mental behavior or emotional disorder. Serious mental illness looks at any disorders that are going to have a significant functional impairment of life. So, and many of the mental health conditions we'll look at, a lot of them are based upon how they actually impact your function in life. So outside of the common like just mental and behavioral disturbances that you have, how it affects your kind of everyday life. So some examples, and again, a lot of what are good ways to kind of look at this is kind of how these disorders get classified. So you have mood or anxiety disorders, post-traumatic stress disorder, and eating disorders. Again, some of which we've already talked about in the pathology section, but we'll kind of expand on them a little bit more here. There's a variety of mental healthcare professionals available. So as an athletic trainer, you certainly have to be able to, again, recognize some important signs and symptoms and obviously act, but obviously we don't treat the mental health conditions. We need the mental health care professional to do that, but we have to be able to recognize, and again, we could kind of act in sort of like the treatment circle, if you will, obviously under their guidance. So one of the things to note with mental health professionals is to be aware of professionals that can prescribe versus non-prescribing. So what we basically look at with the mental health care professionals are those that could obviously provide treatment without pharmaceutical intervention, and those that can then prescribe with pharmaceutical intervention. So for instance, obviously like a psychiatrist, which would be an MD or a DO, they could prescribe medication. A psychiatric or mental health nurse practitioner or a PA can prescribe medication. A psychiatric pharmacist can prescribe medication. Individuals like psychologists, who will usually have a terminal degree, they'll either have a PhD or a specific degree in or a specific doctorate in psychology. Counselors, clinical social workers, sports psychologists, they do not have the ability to prescribe medication. So that's one thing to kind of note, who could prescribe versus who doesn't prescribe. And again, many NCAA athletic departments are adding mental health professionals, and you really should look at potentially, as when if you're going to go work in a sports medicine setting, just be curious and see, are there any individuals that they typically refer to, or kind of who's the first line in kind of that counseling if someone with a mental health disorder would start to be recognized. So probably one thing to be really aware of is behavioral health emergencies. So this is probably one of the most prevalent things to be able to recognize. So as an athletic trainer, you need to be able to recognize a mental health emergency, the signs and symptoms, and then report it. So things like suicidal ideation, again, anything like that has to be taken seriously. So again, anything that's a threat, to them, and anytime a person is a threat to themselves or others, that's something that needs to be dealt with promptly and needs to be dealt with. So suicidal ideation, self-neglect. So, if you see somebody that just doesn't, they fail to attend to their basic needs. So, nutrition, if they're not taking medication the way they're supposed to, those individuals need to be identified and treated. Any intent to harm others. So if they're a danger to others, whether that's expressing homicidal intent, placing others in danger, again, if an individual, say, does have dependents and they fail to provide the needs or safety of those. So anything of that needs to be dealt with and taken very seriously. When we're looking at as far as like, who could be referred to, most college campuses have a counseling center staff member who can offer guidance or referral, and many times many counseling centers offer like emergency services. Many times you look at mandatory reporting by athletic trainers. So a mandatory report anytime a patient poses a threat to others or themselves. So knowledge or intent to commit suicide or to harm someone else requires the AT to act immediately to prevent suicide. So either calling 911 or calling National Suicide Prevention Lifeline. So ATs are mandatory reporters. So anytime something like that, you are required to notify, you're required to notify law enforcement. Some key things: never leave a vulnerable patient alone. So again, make sure that you're kind of activating. There should be sort of a plan in place to deal with this. So again, be familiar with suicide, poison control information, because particularly poison control. So the poison control center number, the 1-800-222-1222 is a pretty common thing, just in case you worry about, like, obviously intentionally overdosing on something. That needs to be known. So again, if a patient is having this, if there's any type of concern over suicide, appropriate authorities need to be contacted. And again, it's a good idea. It's obviously a little outside of the scope of this class to discuss it. It's more of an organization administration thing, but you should make sure that there's kind of like contacts and things in place to make sure that these behavioral health emergencies can be taken care of. So just looking at some background information now, one thing to keep in mind, particularly with mental health disorders, treatment is going to be many times multifaceted. So no two patients are gonna be the same. So again, we obviously want to make sure we refer them to an appropriate mental health professional. The AT may need to provide some initial support while gathering assistance from the healthcare team, but we want to make sure that they reach that particular point. Psychotherapy just basically involves working with any type of therapist to reduce the symptoms. So again, that's going to be kind of part of the process. Obviously, again, how much pharmaceuticals are involved. Again, the patient, if they need a pharmaceutical, the appropriate person needs to be able to prescribe that. So again, not all mental health professionals are going to be prescribers, but they can provide psychotherapy many times, which again can at least help resolve some of the particular symptoms that they're having. So again, we look at a mood disorder. So a mood disorder is basically any prolonged mood disturbance, and there's certain conditions that will fall underneath a mood disorder. So some things that will kind of work particularly for mood disorders, an SSRI, or a selective serotonin reuptake inhibitor. So things like Prozac and Zoloft are things many times that are given to those. Norepinephrine and dopamine reuptake inhibitors like Wellbutrin can be utilized for that as well. Depression just involves intense sadness. So again, SSRIs, or again your selective serotonin reuptake inhibitors are many times going to be the first line medication for depression, and they're typically not addictive. So that's something to kind of to note with that. Mania. Again, these things can all kind of present themselves differently, and sometimes you can have multiple, pathologies coming on at once. So mania involves intense elation, and sometimes those two things could be combined. So bipolar disorder is any time you have a combination of depression and mania. So an individual will kind of fluctuate through those extreme kind of back and forths, with both experiencing levels of just severe depression and kind of cycling back into mania, or they call it manic depressant, is a term you may have heard before with that. So looking at also concussions, so we obviously know, particularly in sports medicine, settings, concussions are a very prominent thing, and there is a connection with concussions and depression. So we find that in NFL players with concussion history, they do find that depression is greater than those with no history. So this obviously is a concern. Again, your symptoms there, anxiety, depression, sleep disturbances in individuals with that have had issues with concussion, and your pharmacologic options when you're talking about, particularly with concussions. Again, selective serotonin reuptake inhibitors, again, they do tend to be a first line. Then your serotonin norepinephrine reuptake inhibitors, or even what we call tricyclic antidepressants, are sometimes another option as it relates to individuals who have issues with concussion and depression. So looking at selective serotonin reuptake inhibitors, so they do tend to be a first line for a lot of mental health disorders. So we'll talk about these, and again, it's important to kind of note all of your classifications. So again, we'll kind of talk about some others as we go along. As always, make sure to make note and be able to recognize names so that you can connect, knowing, some of the more prominent types. So when we talk about selective serotonin reuptake inhibitors, Prozac and Zoloft tend to be, your more common examples of this. Again, this is the most prescribed antidepressant. The mechanism by which it works to increase levels of serotonin. So the idea is that it prevents, hence it's right in the name, selective serotonin reuptake inhibitor. It actually prevents the uptake of serotonin, which then allows greater levels of serotonin to be circulating, which then the idea is that it helps the depression. Now, something to note, interestingly, women do experience more of the adverse reactions with selective serotonin reuptake inhibitors than men, and they tend to have more allergies with them. They tend to have more of the adverse psychiatric reactions to these particular drugs. Again, probably the biggest risk. So again, note the other adverse effects. They do talk about other adverse effects in the readings, so make sure to make note of all of them. But this increased suicidal thoughts and seizures are probably two of the big ones that you can deal with. But again, note some of the other adverse effects. There's some other, like some very common things that people also experience, a thing like nausea. People experience like some sleep disturbances with this, and there's a couple others. So make note of that as you kind of go through your reading. But those are some things. Some other complications that people will have. So one complication anytime with antidepressants is a sudden disruption. So discontinuation syndrome is something that can happen. And again, many times patients will do that. That will cause some of those symptoms and some of those adverse effects. So people with discontinuation syndrome will experience like sweating, chills. They'll get paresthesias. Somnolence is something that they will also experience. Various types of sleep disturbances can occur as a result of discontinuation syndrome. There's also something called serotonin syndrome. That's when you get extremely high levels of serotonin, which actually could be life-threatening. So many times this can occur when individuals take like 2 antidepressants taken simultaneously. So again, that's something that needs to be looked out for. And it's also more likely with higher dosages. So this is something that is a big concern. So obviously you don't want to have excessive levels of circulating serotonin. There's certain symptoms associated with this that could come about. Severe agitation, hyperreflexia, rapid heart rate, confusion, sweating are some of the things you'd experience with serotonin syndrome. And drug interactions. So St. John's wort, which is a popular herbal supplement that would get sold, there's unintended consequences. So if anyone taking any type of antidepressant or any type of sedative or hypnotic, so even like benzodiazepines, people should avoid St. John's wort. And then there's also the concern that with the SSRI and St. John's wort taken together can also increase serotonin levels and cause serotonin syndrome. So again, and this is something with all prescribed drugs. If someone's going to be taking other supplements, obviously they need to be aware of, the individual should always be aware, and they should talk with their prescriber about other supplements they're taking, so in case there's a potential interaction there. So anxiety disorders, again, anxiety disorders are some of the most prevalent psychiatric conditions there are. There's various subtypes. As I said, part of the trick with kind of just being aware of the pathologies is being able to classify them, kind of understand just the definition of what issues are being prevalent. So anxiety just refers to any type of fear or apprehension that's basically unnecessary or out of proportion with a situation. Again, there's various types of these. There's general anxiety disorder, there's panic disorder, there's social phobias. Agoraphobia is a specific subtype where individuals don't like being in uncontrolled social situations. There's social anxiety disorder where people have high levels of anxiety and fear in social situations because they feel very self-conscious about themselves. Those are all different types of things. They list some common anxiety disorders, most of which I've already talked about. They give some more definitions there that you can kind of look at for that. As far as treatments, basically you're looking for things that will calm the central nervous system. So anxiolytics or sedatives are kind of two different classifications. So sedatives obviously just look to calm down. Anxiolytics specifically will work on just reducing anxiety. So your benzodiazepines, and there's many different types of benzodiazepines, and some could be all three. So benzodiazepines can be anxiolytics, they could be sedatives, they could even be hypnotics. Some other drugs, your SSRIs, SNRIs, tricyclic antidepressants can be utilized. Discontinuation of any of these drugs can really enhance symptoms. So again, if someone's going to come off a drug, they have to know that they need to be taken off them in an appropriate medically supervised situations. And obviously overdosing of various drugs, particularly like benzodiazepines, can be lethal. So it's really important that people, obviously that has to be something of a concern if somebody's having like some mental health issues. Obviously overdosing on drugs can be obviously a major issue. Some different examples of benzodiazepines. So these are particularly benzodiazepines that are used to treat mental health conditions. So again, Ativan, Valium, Xanax are different types of what we would call benzodiazepines that can be utilized to treat different anxiety disorders. And then you also have stressor-related disorders. So again, any symptoms that are secondary to traumatic events that individuals occur in life. So these can be frightening incidents, traumatic events that basically end up affecting a person's ability to just function normally. So whether homework, social situations, these become a big thing. Probably one of the the big ones that we all hear about commonly is post-traumatic stress disorder. So post-traumatic stress disorder, if you have distressing symptoms that occur after one or more frightening events that basically affects a person's ability to function. So we hear about, unfortunately, a lot of we hear of a lot of veterans, for instance, that have PTSD because of the things they experience, in war. People that are involved in major disasters, experience this. These are things that, can potentially, trigger this. And again, it really ends up impacting a person's ability to function. There's then acute stress disorder. So acute stress disorder, again, it's still a stress disorder. It looks at anxiety response with some of the re-experiencing or reactivity to the traumatic event. Symptoms usually develop within the first month after the traumatic event. So that's going to be, the person, basically re-experiencing and having reactivity related to that traumatic event. Treatment for this, for any of these disorders, pharmacological and non-pharmacological are options here. So again, you tend to look to try to reduce again the clinical symptoms related to this. Selective serotonin reuptake inhibitors may reduce some of the clinical symptoms. So again, here we see selective serotonin reuptake inhibitors, and there's other antidepressants that can be utilized for them. Again, it's important also too that the athletic trainers kind of understand the components of what we call polypharmacy issues. So when getting treated for pain management and things like that, so the polypharmacy refers to is if a person is getting treated for various things and they have other comorbidities, you have to be aware of if people are taking other medications. So again, they have to understand comorbidities and polypharmacy as it relates, particularly when you look at like pain management options and if a patient would have to undergo anesthesia, because again, things like that could potentially lead to excessive amounts of serotonin. So again, this could be another situation where there's a sort of like a excessive serotoninogenic receptor activity in the central and peripheral nervous system that could lead to, again, a serotonin syndrome, similar to what we talked about with the individual supplementing with St. John's wort. Sleep or wakefulness disorders. So again, this is a pretty common disorder. A lot of people in the United States, it's very common to report sleep problems. Even though they are technically a neurological condition, we do treat sleep disorders with drugs that are used for mental health conditions. So, and again, disordered sleep can lead itself to a lot of like emotional disturbances and a lot of things related to mental health. So that could create a problem. And obviously, there's various other things that can be caused by sleep disorders as well. So insomnia is one of the more common ones. That's just difficulty falling or staying asleep, waking up excessively early, and again, a sensation of, they talk in the book they give with insomnia, they talk about the sensation of unrefreshing sleep. So even if you do fall asleep, you never seem like you get appropriate sleep. Excessive daytime sleepiness is just the tendency to fall asleep during normal waking hours. That's something. Sleep apnea, and this is something that a lot of people do experience. These are episodes of partial or complete closure of the upper airway that occur during sleep, and it kind of leads to basically the person stops breathing while they sleep. It could cause them to wake up, but and there's other health-related issues associated with that. Parasomnias is just abnormal sleep-related events. So parasomnias are things like sleepwalking. People that have night terrors are examples of that. So your treatment for these types of disorders, so hypnotics, they can be prescribed for individuals who need like rapid relief or who have insomnia, particularly with daytime effects with fatigue. So again, some examples of hypnotics are Ambien, Sonata, and Lunesta. Drugs with a short half-life are typically going to be utilized for individuals with insomnia, whereas drugs typically with a longer half-life, that's going to be prescribed for individuals with sleep onset or maintenance insomnia. So, for instance, Ambien is an example of a drug that has like a shorter half-life. So that will typically be utilized for individuals who just have insomnia. There's other things you do have to be aware of. So again, patients who experience daytime sedation when taking these or having coordination should avoid activities that require alertness. So those are some of the adverse effects related to taking hypnotics. Other adverse effects, amnesia, hallucinations, incoordination, falls are always a significant risk when taking hypnotics. So those are some things that you just need to be aware of for individuals if they are taking hypnotics. Just be aware, make sure that if they start taking them, they should just be careful or maybe even avoid driving. Obviously, contact sports, there could be some issues with that as well. So looking a little more at some neurodevelopmental disorders, so attention deficit hyperactivity disorder. So adult ADHD, so again, a persistent pattern of inattention or hyperactivity and impulsivity that again is going to interfere with development. It's not as clearly defined or diagnosed adults as is in children, but it does present with a combination of problems relative to attention span, impulsive behavior, and some other traits. So, and even though it's not as clearly defined with adults, it could lead to some poor self-esteem and performance. A lot of adults who develop ADHD can develop depression. A lot of them could also have some issues with anxiety. As far as the treatment related to these, most adults are very successful when getting treated with stimulants, which sounds a little weird. You said, well, geez, why would you treat a condition that basically creates hyperactivity with stimulants? The issue with ADHD is just the wrong part of the brain is basically getting stimulated. So the idea is you stimulate the other part of the brain and that reduces your symptoms, which in many cases it does. So many times they are selective, basically getting treated with the stimulants. So as far as that goes, so your NDRIs, your Ritalin, which gets absorbed rapidly. So this is basically a norepinephrine and dopamine reuptake inhibitor. So Ritalin is one of the more common ones that does get utilized. Historically, it's the first line of treatment. It does get absorbed very rapidly and is first past hepatic metabolism. Mixed amphetamine salts are kind of another one that do get utilized. These aid in hyperactivity and impulse control. So some of your mixed amphetamine salts, Adderall is probably the one most people have heard of. There's Dexedrine, there's Procentra, Zenzetti, Vyvanase is another one. Again, these basically just affect chemicals in the brain and nerves that contribute to that hyperactivity and impulse control. So these are just some of the different medications utilized to treat the ADHD. Eating disorders, which we spent a good amount of time discussing eating disorders in the pathology section. Again, it's disordered eating is an entire spectrum of abnormal eating behaviors and abnormal behaviors around food and eating. Again, probably the two big ones that we talk about a lot are anorexia nervosa and bulimia nervosa, but there are other ones as well that also need attention. But when you look at the eating disorder, it's an abnormal behavior clinical classification. The NATA has guidelines regarding kind of the team structure for kind of recognizing these as far as the treatments and how they get involved. So when you talk about anorexia nervosa, so again, I would encourage you to make sure, obviously, as we discussed in the pathology section, what are the signs and symptoms, how do we differentiate, particularly between anorexia nervosa and bulimia nervosa. So antidepressants and extensive psychotherapy would be utilized in as far as anorexia. So again, we will kind of utilize both of those in that. With bulimia nervosa, selective serotonin reuptake inhibitors seem to have the best evidence of efficacy when treating this. The dosages, though, typically need to be a little bit higher than what are typically given for depression. So again, usually they talk about like 60 to 80 milligrams a day of fluoxetine will get utilized in treating this. So that would be something that is a little different. The dosages would be a little bit higher. Again, you'd want to make sure to, particularly with bulimia nervosa, treat the anxiety, the impulse disorders related to that, and the obsessions, and again, make sure to again include psychosocial therapy with that as well. And again, make sure again to look at some of the potential side effects as it relates to, particularly when you talk about higher dosages of selective serotonin reuptake inhibitors. And as it relates to that. So again, your typical side effects you get, there's the potential for added side effects with the higher dosages. Substance abuse related disorders, again, this is something that we talked about extensively in the pathology section of the course. So again, when we talk about substance abuse, here we basically look at what ends up happening is the substance basically activates sort of the brain's reward system. So the person, the person gets this satisfaction based upon using the particular substance that they're using. So look at the classes of addictive substances. They're listed there, and we did kind of talk about in the pathology section kind of the different things that individuals experience based upon the particular substance that they're dealing with. As far as treatment, again, obviously it's going to be based on the substance and the circumstances kind of surrounding the particular substance. So there's a couple here we're going to talk about. So anabuse and naltrexone, these discourage alcohol use. So anabuse particularly discourages alcohol use through an unpleasant drug-drug interaction. So basically, if you're on anabuse and you consume alcohol, you get extremely ill from it, which basically discourages you from using alcohol. Naltrexone particularly works to decrease cravings through the kappa opioid receptors. So that's a little different than, so again, different mechanism of action, but they both kind of work in the same fashion. Wellbutrin, when you talk about nicotine, so Wellbutrin is going to decrease nicotine cravings. Methadone is used to reduce withdrawal symptoms. So when someone's withdrawing from an opioid, if they start to experience withdrawal symptoms, methadone can be utilized in kind of helping with that. Kind of going back up to alcohol, I forgot to mention this. Camprol is another, basically what it promotes abstinence from alcohol by decreasing neuronal hyper excitability. So that's something that I forgot to mention with alcohol. So just kind of note those. Another thing just to kind of note in as far as so we talk about methadone for reducing withdrawal symptoms from an opioid. It's important to note and be aware of the administration of Narcan in the case someone does overdose on opioids. So Narcan should be something that is good to have around, just because if someone does happen to overdose on an opioid, it can be administered fairly easily. So that's another thing that's kind of important to mention in as far as kind of managing substance abuse. So in summary, again, as far as this relates to sports medicine, again, obviously, concussions or just even injury, you always have to be aware of depression. So again, individuals, if they experience like a pretty significant injury, again, being kind of losing that outlet, or being taken out of athletics for a long period of time. You do have to be aware of that. We talk about, even in modalities class, we mention about like the psychological aspects of rehabilitation, and why it's important to kind of note and be aware of signs and symptoms of depression. Again, many medications, and at times, sometimes multiple medications will be required. So, and again, then there's always the risk for potential effects from that. So again, look at your drug classes. Be able to recognize names and classifications. So again, there is a nice table at the end of the chapter, as there usually is at some point in the chapter, that kind of goes through some of the different drugs. So you should be familiar with those. Again, always monitor the risks. Again, there's a lot of them do, particularly a lot of the antidepressants. There is the black box warnings regarding, potential, suicidal ideation. So that's something to be aware of. And you have to be aware of the misuse or abuse of amphetamines. Individuals will sometimes abuse those. So again, just being aware of substance use and abuse is something really important. And these are your objectives.